All right, so this video is called The Uninvestigated: Why Black Women Are Told Everything Looks Normal, even though their minds, brains, and bodies signal the exact opposite, and what finally changes the game. Let's begin. All right, so let me start by asking, have you ever gone to your doctor because something clearly felt or was off, only to be told everything looks normal? And yet, here you are, still dealing with exhaustion, brain fog, mood swings, anxiety, poor sleep, agitation, on medication but not feeling any better, or maybe even getting worse. Well, if this has been your experience thus far, I want you to know not just stress. There are drivers behind those persistent symptoms that nobody's ever investigated. Yet, that is. So, you are in the right place. And over the next, let's say, 30 minutes, I'm going to share with you why so many high performing, high achieving, and high functioning Black women leaders, role models, and game changers within their families, communities, professions, and businesses are told everything looks normal, even though their minds, brains, and bodies signal the exact opposite. Psychiatry changes the game by uncovering what traditional healthcare often misses, dismisses, or ignores. And lastly, I'll also share how you and I can work together, if appropriate, at the end of this video. So, before we go any further, I should briefly explain why I care so much about this. Hi, I'm Dr. Devin N. Bailey, family nurse practitioner, psychiatric mental health nurse practitioner, certified functional psychiatry provider, diplomate of the American College of Lifestyle Medicine, and the founder of the Afia Effect Family Healthcare Services, where I serve those located in Virginia. I'm also a Black woman who understands the healthcare system, both professionally and personally. For almost 15 years, I've worked with men and women who were trying to figure out why they felt mentally and physically off, even though they were told everything looks normal. And of course, it didn't take long for one thing to become very clear to me. Black Americans, and more specifically, Black women, weren't being thoroughly investigated. Their doctors weren't asking the deeper questions of themselves, like what is being missed, quote. Instead of starting by trying to force these women who have historically had their strength and endurance misjudged, I started with an investigation because my lifestyle medicine, preventative medicine, and being a Black woman clinician in America. Which is why I practice what I call investigative medicine and psychiatry. I mapped the mind, brain, and body. I looked at how biology, race, culture, psychology, and lifestyle shape the way each part functions. Had missed, dismissed, minimized, and simply never investigated. And when I did that, something interesting all began to make sense or even fall off. These women, who were the empowered resources and directors of their lives, also became the empowered resources and directors of their health. As a result, they gained clarity, restored their energy, and their sense of self, which they had begun to accept as lost, returned. Experts in their minds, their bodies, and their brains, and investigating. Here is a review for you to pause and read if you like. So, if you've ever wondered why the symptoms don't quite fit the diagnosis that you've been given, or how they continue to persist in the midst of quote unquote normal, or doing or trying what it feels like everything, let's get into it. Let's discuss how and why depressed, distracted, emotionally overwhelmed, do seemingly everything right, the realization. Here's the realization many of the women eventually have. They were told or made to believe schizophrenia, depression, maybe anxiety, maybe bipolar disorder, personality disorder, fibromyalgia, maybe quote unquote just stress and doing too much. What often gets forgotten is that quote unquote normal looks different on Black women. Nothing really happens without cause, and the mind, the brain, and the body function together. For example, depression and ADHD, they don't look textbook, particularly in someone who has been generationally conditioned to survive, to perform, and to appear strong. That strength is not a performance, it's real, and it's also an adaptation. It is survival. Because the mind, the brain, and the body depend on nutrients, hormones, metabolic function, and safety to operate. And when those are biologically adapted to or for survival, no amount of strength can compensate. Operate as separate entities. They are actually dependent and therefore influential of each other. Like in business, team sports, work, or family dynamics. When one part is off, the other parts will overcompensate until they can't. So when ability, medications that don't work, or side effects, and so forth, the question shouldn't be what diagnosis fits these symptoms. Instead, the questions what biological, racial, cultural, psychological, and lifestyle systems and patterns are influencing how this person's mind, brain, and body are currently functioning. Because once we start looking at every person as a whole person with a unique history and story, many things that once seemed confusing suddenly make sense. And here's the big one, perhaps even the precursor mode. Persistent survival mode, generationally transmitted through the lived embodied experience of systemic and pervasive racism. Racism that is not ancient history, but a very present, ongoing biological stressor with many measurable consequences. When these factors aren't acknowledged, especially in healthcare, the investigative gap exists and persists, and these women spend years, quote unquote, treating or doing, thinking they're treating or doing the right things when they're actually doing the wrong things and treating the wrong things. And these women and everyone connected to them and everything connected to them never really experience health across all facets of life, relationships, education. Because the deeper underlying drivers or causes were never acknowledged, considered, and as a result, not investigated. And think about the very real impact this gap has on individuals between managing and treating persistent symptoms and actually investigating, identifying, and treating the root causes of those symptoms. Enter the grossly disproportionate healthcare consequences experienced by Black Americans, specifically Black women. Missed diagnosis, misdiagnoses, delayed interventions and poor prognoses and outcomes. Statistics and the experiences are the receipts. The type of women who are just like you, this moment is incredibly relieving because they realize they weren't imagining the symptoms after all, which they already knew. Their minds, their brains, and their bodies were trying to communicate something that was simply being dismissed, missed, and ignored, and uninvestigated. And when the investigation finally took place, the answers in the game changed, as in the individual and generational health. Review for you to read. All right, so the If you're still here, something I've said has landed, and you already know it. You wouldn't still be watching otherwise. So let me speak directly far longer than they should have before finally deciding enough was enough. I know what this come or walk through my virtual door. And high functioning Black women, functioning or identifying as wives, moms, aunties, community service and organizational members and leaders, educators, medical professionals, lawyers, judges, executives. They have spent years being strong, looking great on the outside, and pushing through symptoms because they have people and other things who rely on them. But behind the scenes, they don't always have the clinical language for it that makes the simplest tasks feel anything but simple, when focus, drive, and execution used to be some of their greatest strengths. Feel bigger than the moment deserves. An anxiety and an emotional overwhelm so persistent that somewhere along the way, they stopped calling it a symptom and started making it who they were, owning it as quote unquote my anxiety. Energy, motivation, and desires that have disappeared, not just for sex, vacation lists that grew longer over time. With each new prescription often addressing the side effects of the previous medication. Medications that were supposed to work that didn't, or that once worked and no longer do. By way of bloating, constipation, diarrhea, severe cramping, irregular cycles by the healthcare provider. And a life from the outside that looks as though you've made it. The career, the title, the relationship, the family, the accomplishments, the beauty, the money, the body. And not fully living it. And when they went to their doctor, the response was usually the same. Everything looks normal or good. Come back if things get worse. The assumption that everything must be fine because it looks fine, or it's just stress, or it's all in their head, or it's not that serious. What was causing the symptoms to appear in the first place. And all the while, the woman actually experiencing all of this knew something wasn't right. There had to be more to the story. Compared to how it actually felt to live it was almost always what finally brought her, or maybe you, here to me. Deserve an answer, and that answer it actually exists. So I want you to take note of these 5 things. Nor does it indicate optimal health. Disease, not prevent it, not to catch the early dysfunction that precedes it. Primarily derived from white male and secondarily white female populations. So this is how Black women who are justifiably raised to survive, as in be and appear strong, suppress vulnerability, prioritize others, get things done, endure, while their minds, their brains, and their bodies are signaling something that is the exact opposite of 30, a vitamin B12 of 478, a high sensitivity C reactive protein of 2.9, a white blood cell count of 3.7, and then the deeper investigation told the rest of the story. An omega-3 index of 3.24, a lipoprotein A of 184. Here on a standard lab panel, but numbers that were behind the scenes driving her towards sleepless nights weren't in her head. They were in her blood work. We just had to know where. You can't solve a biological problem with a psychological intervention or symptom management. The healthcare system is largely built for it, move on. What it is not built to do is ask the harder, more important question. Why is this happening in this particular person, in this particular body, and at this particular point in their is built around? Take example patient B, diagnosed with bipolar disorder, prescribed a mood stabilizer for it. She came because someone she trusted referred her to me for a second opinion. And good thing she did, because that diagnosis wasn't bipolar disorder. Yeah, systemic inflammation, vitamin D deficiency, a genetic folate conversion issue, impaired nutrient absorption due to weight loss surgery, inadequate fat, protein, and carbohydrate intake, and so we corrected the biology, addressed the nutrition, started somatic experiencing therapy for the trauma disorder diagnosis, uncovered ADHD and complex PTSD work, or while she did that work, actually, she got promoted, negotiated a raise, investigated instead of just managed. So number 3, the earlier you investigate and identify are better than treatment. Symptoms don't just arise out of nowhere. Disease doesn't either. And in most cases, there is never a single cause. Instead, are communicating before the diagnosis typically even appears. And when these levels are respected early on, the symptoms that are often much easier, or the symptoms are actually much easier to correct, treat, and then reverse. Because anything and everything that we allow to go unchecked, from disrespect to the medication that isn't producing the expected results, to the things that we decide to ignore, especially in our health, they all naturally get worse over time. So think about what gets lost when symptoms are missed. No diagnosis at all. Self-doubt enters. Generational wealth deferred. Health declines. That is the real price of no investigation. Now, early on, that is the work. That is the legacy. Or taking multiple medications often reflects uncertainty of diagnosis or management of the side effects. Polypharmacy rarely reflects necessity or need for the actual medication or medications. So do me a favor and count the number of prescription medications, the vitamins, and the supplements. Number 5, identity is everything. Know the truth. Get your mind right, align only with the truth. Not the circumstances, not the symptoms. Be the empowered resource and director of your health and your life. Not disempowered, not dependent, and not codependent. do mental do mental and physical health and care and life differently against the status quo. Takes or not have that life. Yield and cultivate individual and generational health, well-being, and prosperity. Experience the Afi effect, or the side effects of health, the side effects of wholeness of mind, body, and spirit, not the side effects of illness. Journey back to Afia. Of being free from and of physical or psychological disease, illness, or malfunction, or wholeness of wholeness of mind, body, and spirit. I use the word back intentionally because health and wholeness, which by definition trying to reach for the first time or try to attain for the first time. Prosperity. They're just your mind, your body, and your brain, and your spirit screaming to you to go back the other way. But that's a conversation for another day and time. In diagnoses, the journey back to Afia focuses on considering, investigating, and treating the biological, racial, cultural, psychological, and lifestyle drivers that influence how your mind, body, and brain function. The process begins by mapping your health, history, and your story, the symptoms and the current diagnoses, then identifying patterns and investigating key biological, racial, cultural, psychological, and lifestyle drivers that influence mental and physical health or cause mental and physical illness. Instead of just guessing, diagnosing, and or treating prematurely, we investigate and acknowledge things like the inflammation, the nutrient deficiencies, metabolic health, hormone changes, stress physiology, and safety, lifestyle and relationship patterns, family history. And here's how the game changes. You stop being managed and start being heard, stepping back into your role as the resource and director of your health. The decisions we make, you. Therefore, or in turn, or as a result, your mind, your brain, and your body, after years of compensating, adapting, and carrying what was never properly addressed or even because it's different. Rest. Trajectories begin to change. Because we may be even causing them all along. Here's a review. Thinking. If this way is better, ever talked about or done these things? Well, again, the healthcare system wasn't built for everyone, and that data and history prove it. Lab reference ranges, diagnostic criteria, and clinical guidelines were largely developed from research that centered white males and later white females as the default. Everyone else has either been trying to or has been forced to fit into a system that was never designed with them in mind. Second, again, the healthcare system isn't broken. It's working exactly as a driven model that rewards speed that healthcare providers have to practice. What the system doesn't reward or have time for is the deeper investigative work of identifying the biological, racial, cultural, psychological, and lifestyle patterns driving symptoms long before a disease exists. Last, stigma doesn't live in people's heads. It lives worse mental and physical health outcomes for anyone who presents with mental illness related symptoms or psychiatric diagnoses. And guess who is impacted the most? And ask me how I know. To offer a person centered, personalized path to understanding what your mind, your brain, and your body have been trying to say all along. This kind of investigative work demands something that traditional health consideration for the whole person sitting in front of me. To intentionally center Black women, which, by the way, does not mean excluding others, but definitely centering Black women. To operate outside of and therefore not be insurance doesn't determine what options are available. To work with a limited number of patients at a time, because this work deserves and needs that kind of space. And to do so primarily remotely, to increase reach to all of Virginia, meaning you can live anywhere. Clinical care services and appointments. Another review. So finally, you are here for a reason, so let's get it. There is no question. You are a leader, a role model, and a game changer. You wouldn't still be here if you weren't. You realize that the persistent symptoms or diagnoses have deeper biological, racial, cultural, psychological, and lifestyle drivers, and your desire to get back to Afia and to have that life, now that you know what they mean. So, your next step is actually quite simple. That And if you'd like to do that with us, that investigation with us, the first smaller step is your clarity consultation. This clarity consultation and discuss the patterns you've noticed and determine the next step on your journey back to Afia. In many cases, this consultation, the goal is simply clarity. And in relation to health and life that you want, what the most appropriate next step on your journey back to health looks like, and whether that next step is with us. So it bears repeating what this practice is and what this practice isn't. It is personalized, we center Black women, and we don't operate under an and you already know this isn't for everybody, but it is for you if you have reached the point where partial answers or persistent symptoms are no longer acceptable, because you understand at your core that your health, your wholeness, and your prosperity are worth more than that. If you're ready and willing to invest your time, your energy, your focus, and if you are genuinely open to the full spectrum of what health requires, whether that is medication, therapy, nutritional intervention, rest, or the power of healing and community, all of it, whatever it takes. As quo, without apology, and with full commitment to the work that real investigation and real healing require, and to finally, unapologetically, have the life that has always been yours. This is for you. And for people who are comfortable where they are and don't want to change. It is not for people who are not ready to look honest patterns of it all. And it's also not for people who prefer or even maybe just need the traditional insurance driven model of care where symptom management is prioritized. Asked because there is no time. So, if what I've said resonates with you, what I've discussed, you are ready to investigate and change the game, I want you to click the button or the link below this video share this video with someone for whom our investigative medicine and psychiatry services would benefit. And remember to go from confusion to clarity to understanding to changing the health, well-being, and prosperity game to getting back to Afia. You got this. Me, and she's also supportive and helping and helpful and helping to ensure other parts of my life, talk therapy, getting sleep, etc., are helping me work towards my mental health goals. I very much recommend her. I've already learned so much about myself from working with her. Dr. Bailey is truly amazing at what she does. She takes the time. Other reviews, you can pause and read them. Foundational verse. Dear friend, it is my prayer that you prosper in all ways, always, and be in good health, even as your spirit prospers. And that's 3 John 1-2. All right. Remember, investigate with me or with whomever. Talk to you soon. Bye.